My name is Brianna Sanger. I'm the Staff Education and Practice Manager of Clinical Training Programs here at Hutch. So I've been in oncology nursing for almost my entire career. Started in medical oncology and then moved into bone marrow transplant and immunotherapy, and have been in this role, in a nurse educator role here at Hutch since 2019. I don't know if there is one typical day for a nurse educator, but on any given day, there are portions of this job that are focused on kind of the assessment of education and learner needs. So that looks like a lot of heads down work. That might be reviewing policies or reviewing literature or best practice. There's a fair amount of curriculum and educational content development. So again, that can look like a lot of heads down work, a lot of collaborating with different stakeholders, especially our partners on the clinical operations side of, what do our nurses need to be able to do their jobs? What sort of educational support do they need? And then on some days, it's a lot of teaching. So holding classes, providing in-services. And then some days it's all of that. We also do, again, a lot of collaboration with different stakeholders throughout the organization. So how we can support our operational leaders and just other roles that are impacted by the education that we provide. Well, my role oversees a lot of our training programs. So our RN residency for new graduate RNs, our medical assistant apprenticeship program, our nursing student rotations, and a lot of the other kind of programmatic support for those training programs. So things like our preceptor class. I've always really enjoyed and been passionate about teaching other nurses, and being in the role I'm in now, overseeing the team who runs those programs. It has allowed me to, I'm kind of vicariously through the other members of my team, help to support the nurses in really growing the workforce, supporting our new nurses who are just entering the profession, our new medical assistant apprentices who are training to become certified MAs, our nursing students and nursing assistant students as well. So that's been really fulfilling for me personally, being able to invest in nursing as a profession in those ways. Something we've seen for a while now is this shift from inpatient care to outpatient care for oncology. Been seeing for, again, a while now, more patients being treated for their cancer in the outpatient setting instead of needing to be hospitalized for everything. So that has meant that we have been seeing higher acuity of patients in the outpatient setting, and also that a lot of our nurses who are just entering the profession or who have just graduated from nursing school are looking at those outpatient jobs as their first nursing job. It used to be you would get your years of inpatient experience in oncology before transitioning to the outpatient, and there's still a fair amount of nurses who do that for their career path. But we're also seeing a lot of nursing students and new graduate nurses who are wanting to just start their career in the outpatient or ambulatory setting. So as the education team, that's something that we have been really trying to prepare those nurses for, who maybe they don't have the same inpatient oncology experience, and how do we prepare them to be able to safely and effectively take care of our patients in this very specialized setting. We have a new to specialty fellowship program here as well for nurses who have experience in other specialties but are wanting to make that transition over to oncology, who have already perfected a lot of those foundational nursing skills and really just need that additional support in that specialty content to be able to care for our oncology population. So we have a fellowship program for nurses who can receive some of that specialty training to be able to make that transition into, again, our very specialized area. It sounds maybe a little obvious, but you need to like teaching to be a nurse educator. So that is definitely something that I would consider if you think a nurse educator role might be a good fit or a good next step. Do you enjoy teaching? Do you enjoy supporting others in them performing the role to the best of their ability? For many educator roles, it is a step back from the direct patient care aspect of nursing, which some people are looking to make that change. And for some people, that's a really difficult transition. So that's another thing to consider. How much are you wanting to maintain a direct patient connection, or how much are you wanting to focus more on kind of the staff development and allowing the staff to provide that patient connection? For folks who are interested in the nurse educator role, I think a great first kind of dipping your toe in the water is precepting. It gives a really good intro to teaching another professional, because that's a lot of what nurse educators do. So getting a little bit of experience in how do you provide education to another nurse, how do you assess for where their gaps are, how do you assess how they're progressing, how do you mitigate challenges or bumps in the road, and how do you make those decisions of when more support is needed and what that support looks like. So precepting is a great kind of first step in that. And if that's a role that you've done before and really like, or feels really enticing to you, I think that's usually a good indicator that an education role is worth pursuing.